Hello everyone, my name is Sita Poral Sapkota. Today I am here to present on the topic the efficacy of cognitive behavioral therapy, otherwise known as CBT, in the treatment of major depressive disorder, otherwise known as MDD. This presentation is based on the assessment 1, which is a written report about 3 systematic journal article review. The presentation is prepared for the University of Canberra. The unit name is the Epidemiology and Principle of Research. The overview of the presentation. The main point will be covered in this presentation. They are: what is major depressive disorder, MDD, the cognitive behavioral therapy, CBT, and its relevance in mental health nursing, research strategies used to retrieve the information, level of available evidence, the quality of evidence, the sources of bias, reported outcomes, and finally lesson learned from the review of the literature. So, what is major depressive disorder? According to DSM-4, the major depressive disorder criteria, an individual who exhibit at least 5 of the following symptoms continue for 2 weeks with marked diminishing in functioning, such as low mood must be present for diagnosis, withdrawn motivation must have for the diagnosis, marked weight gain and weight loss, the poor sleep and oversleep, feeling tired and reduced energy, hopelessness and helplessness, slowing down of the thought process and reduction in physical activity, suicidal thoughts and poor concentration. While talking Okay, while talking about the depression, it is worthwhile to know the prevalence of depression in elderly. According to World Health Organization, depression is the leading cause of worldwide disability. In worst case scenario, over 1 million people lose their lives every year due to depression-led suicide. The major depressive disorder is associated with the significant health impairment and mortality among older adults. It is predicted that approximately 7% of overall elderly population who are over 60 years of age account for 1.6% of complete disability. Institute of Health Metrics and Evaluation. What is the reason for selecting CBT as an intervention for major depressive disorder? Because CBT are based on the statement that irrational belief, reduction in regular activities and associated skills and impairment thinking and coping strategies which contribute to depressive thoughts. Therefore, the aim of the CBT are to change belief, action, skill and related thoughts. So, what is the importance of CBT in mental health nursing? Because CBT is a psychological therapy, it is the most widely researched form of psychotherapy and supported as a core management selection for psychological health problem by National Institute of Clinical Excellence. The goal of the CBT is to identify and understand the problems and the association between negative thoughts, behavior, emotion, and psychological sensation. CBT suggests the negative feeling can lead to negative emotion and physiological sensation. As a result, the individual develops unsupportive coping strategies such as self-harm and suicide due to impaired mental state. The purpose of the CBT is to recognize, understand, and stop these intrusive thoughts, behaviors, and emotional sensations, and to develop safe, sound, and speedy recovery. CBT directly focuses on the signs and symptoms of distress, and then evaluates the thought form, core beliefs, and the improvement in a supportive behavior reaction. In my next slide, I will be talking about how I sourced these 3 systematic journal articles. In order to find 3 systematic journal article reviewed, I went to the university library homepage. The search, then I enter the search keyword. Then I limit my search with taking on the full text and taking on a specific database, and then year of the publication. Then I scroll down to find the relevant articles. Search strategies continued. The databases I've used to retrieve this information, they are EBSCOhost full text, Medline, Sinhal full text, PsycInfo, PsycArticle, Psychology and Behavioral Science collection. The search strategies used continued. The keyword I've used to find these studies, they are depression, depressive disorder, older adults, older people, cognitive behavioral therapy, CBT, and sometimes I entered systematic review and meta-analysis. Of available evidence. The study chose there are 3 systematic reviews. Level 1 is a systematic review of level 2 studies, which are randomized controlled trial. Level 2 a randomized controlled trial. The level 3 a pseudo randomized controlled trial, and a comparative study with a concurrent control. Level 3.2. Level 3.3 a comparative study without control, and level 4 is a case series with either post-test or pre-test or post-test outcome. The levels of available evidence continue. The systematic review. As I mentioned you before, all my three articles they are systematic review and they are level 1 evidence. My first study is a meta-analysis and meta-regression of randomized controlled trials. So it is considered as a level 1 evidence. My second study is a network meta-analysis, which is also considered as a level 1 evidence. My third study is a systematic review and it is the level 1 evidence too. So the quality of the evidence. My first study is a meta-analysis and meta-regression of randomized controlled trial. The study is considered as level 1 meta-analysis and meta-regression of RCT. A Rixa bias tool was employed and studies were screened against 5 areas of bias. No studies were excluded because of inadequate or unclear rating in all 5 areas of bias according to Cochrane. The Cochrane collaboration of RCTs, PubMed and Medline were searched to retrieve the information. Potential sources of bias are reviewed. Meta-analysis and meta-regression of RCTs, they are low risk of bias. They are considered as low risk of bias. Study is current 2012. The heterogeneity in impairment and setting were used. Evidence continued. My second study is a network meta-analysis. The study is current 2015. The study is the first network meta-analysis. Medline, Embase, Cochrane collaboration of RCTs and PsycInfo were searched. The outcomes are greatly reliable. Study conduct proper assessment with face-to-face CBT with distance CBT and other treatment as usual. The study is constructed on considerable numerous trials and many of them evaluate to be the low risk of bias. Third study is the systematic review. The study is considered as level 1 evidence. It's a systematic review. The study is current 2011. The databases searches for the studies are Medline, Embase, PsycInfo, Sinhal, Cochrane and RCTs. The study were evaluated for their quality using the quality rating scales QRS and achieved overall mean of 26.6 out of 46. Heterogeneity in the studies were employed and measured by using T-square test. Out of 360 studies, only 11 studies met the inclusion criteria. Study is applicable in the Australian healthcare setting. So, what are the reported outcomes from 3 systematic reviews? The first study is a meta-analysis and meta-regression of randomized controlled trial. CBT is considerably far more active in decreasing symptoms of depression than common treatment and on waiting lists and without comparing with active control. At a 6-month follow-up, the similar pattern of result was obtained. Result could not be extracted about the overall average effect sizes at 9 to 12 months follow-up between CBT and other treatments such as pharmacotherapy and other psychotherapy because of the variability in effect sizes. Ultimately, the efficacy of CBT is greater when the groups are not receiving any active treatments and had higher remission rate. The second study is a network meta-analysis. CBT is compared with the pharmacotherapy and other psychotherapy. Clients who stop medication due to undesired side effects, they are barely reported. Less resources intensive treatment, the less resource intensive intervention have similar effects as face-to-face CBT and other psychotherapy. Study 3. A systematic review. The efficacy of group CBT in the treatment of depressive symptoms are shown to have significant effect in contrast to the clients and on waiting lists and on therapeutic treatment. The stated benefit of group involvements in the contrast to the other therapeutic intervention did not influence the statistical significance. So, what lesson I've learned from the review of this literature? CBT is an effective intervention in the treatment of depressive symptoms, especially with older adults. CBT can greatly improve the quality of life. CBT can result long-term remission of depressive symptoms regardless its place of practice and methods of delivery. The group CBT in older people with depression is effective. So this is my reference list that I have used in the presentation. And thank you for listening my presentation. Thank you very much.